Hello, everyone. Thank you for attending this talk. I'm Dr. Jeremy Fisher. I'm the program director for Henry Ford Macomb. We're a community-based family medicine program in Macomb County, Michigan, just north of Detroit. We have 12 residents. We're osteopathic recognized. We're going to be talking a little bit today about some OMT for the weekend warrior. This is my associate, Dr. Christopher Zapp.
Hello, yes. Christopher Zapp. I'm a family medicine practitioner out in Washington Township, was also in Macomb County, Michigan. I also am an assistant professor of OMT at MSU-Com, and I've been teaching there for the past 3 or so years. And again, OMT is something that I utilize pretty much on a daily basis in my practice. So I think a lot of these cases will be helpful to help guide a lot of treatment.
So what we're going to talk about today is things that we're seeing in our practices. Ourselves, like many of you, have had patients on various degrees of shutdown for the past year with the pandemic. At the same time, we're seeing people get into more and more different activities that they formerly weren't used to. So we're seeing some more acute musculoskeletal things come into our offices. What we wanted to do today, our objective with this talk, is to kind of discuss a couple of cases and some OMT that you can use in your office to help with those patients. So we have a 40-year-old male, comes into the office with lateral pain on the right ankle. He started playing basketball this weekend. It's his first time out since the fall. He noticed the pain while he was playing. He tweaked it a little bit, but he was able to continue playing. He has no bruising. He's able to walk on it. He doesn't have a limp. He took about 800 milligrams of Motrin. He noticed that he got some moderate relief with this. Your exam shows pain and swelling. Seems to be focused over the right anterior talofibular ligament. Patient has no bony pain. There's no laxity to the joint. So you're looking at the diagnosis of an ankle sprain. So Dr. Zapp, could you demonstrate some techniques that you might use for this?
Absolutely. So to start, we'll begin with counter strain. So counter strain is a nice indirect technique that you can use to help treat an acute ankle sprain. So in use of the counter strain technique, what you're doing is palpating along the muscle belly, feeling for any noticeable tender points themselves. So as you're evaluating for those tender points, you're working your way down along the muscle belly itself, feeling for any areas of discrete hypertoned muscular tissue, as well as for any pain that the patient might experience at palpation of these points. Once you find and identify a tender point, you're going to have the patient compare this to a 10 out of 10 pain. From there, you're going to work to shorten that muscle tendon. Very often, here you will flex the knee and then plantar flex the ankle as well to release and reduce the overall size and length of those muscle fibers. You're going to hold this for about 90 seconds or so. Then after this point, you're going to return back to neutral. You can also find some tender points along the anterior ankle as well. Again, palpating at each discrete point, you'll find an area that feels hypertone and the patient's complaining of pain there. So from here, you're just working to kind of wrap around that tender point here. So you'll often dorsiflex and you can evert a little bit or invert depending on what provides the most amount of relief. From here, you're going to, once you find that point of ease, you'll hold for 90 seconds or so. And then once the time has elapsed, you'll return to neutral. Aside from counter strain, we can also do some myofascial techniques as far as soft tissue myofascial release. Within the muscle belly, you're really just working to distract. You can do some lateral traction along the muscle belly, as well as some longitudinal stretches as well. In addition, you do want to pay attention to the interosseous muscle. That can be implicated in a lot of ankle fractures or ankle sprains as well. So just applying direct pressure to that can be helpful just to kind of distract and allow for relaxation of the tissues in this area. And then one last technique we can always work with is muscle energy technique. So very often with inversion and plantar flexion injuries, such as ankle sprains, the foot will overextend into plantar flexion. So the ankle prefers to be plantar flexed and often will resist dorsiflexion. So to treat with muscle energy, you'll go directly into that barrier, that dorsiflexion barrier. You'll have the patient push or plantar flex upwards, hold some resistance for 3 to 5 seconds, relax, and then take up the slack into the new barrier. And again, you'll do this 3 to 5 times for 3 to 5 seconds. And relax. And then following that, you'll evaluate for overall range of motion of that ankle. Additionally, from a muscle energy standpoint, with ankle sprains, you do want to make sure to pay attention to the joint above and the joint below, particularly with reference to the fibular head. So to palpate the fibular head, you're just going to feel along the bony prominence of the knee below the joint line. With your index finger, you can feel the posterior aspect of the fibular head, and then with your thumb, you'll toggle the anterior portion of it. And generally, it'll glide posteriorly, so back, and then anteriorly forward. And with this, with inversion injuries, such as most common ankle sprains, that fibular head is going to be stuck in a posterior position. So with that, we want to work to bring it back to a more neutral or anterior position. So with that, you're going to firmly hold on to the fibular head, taking care not to apply too much pressure to the lateral aspect because you have that peroneal nerve coming around the side as well, and you don't want to cause any injury there. But as you're holding on to the fibular head, you're going to apply a little bit of dorsiflexion to the ankle. You're going to have them plantar flex against your resistance. As they're doing that, you're going to apply anterior pressure to the fibular head to help drive it forward as well. You're going to hold that for about 3 to 5 seconds, have them relax, engage the next barrier, and then have them repeat. Again, repeating about 3 to 5 times.
So with ankle sprains, don't forget that during the acute phase of the injury, ice is really helpful with this. Making sure compression on the area with like an ACE bandage can be helpful. Have them elevate with the acute swelling. As the person's recovering, it's super important for them to remember that they need to rebuild that proprioception and regain the strength in the ankle. One simple way to do that is the person can put a towel under their foot and bunch it with their foot. Another great way to get proprioception back is have the person practice walking over uneven ground, something like trail walking. The other thing that can be helpful is just as simple as having them stand on one leg. If they need to, using a chair for balance, but by standing on that, that can be very helpful to keep that, to rebuild the strength in the ankle, so that's less likely.